ever felt an ache in your chest without knowing why? Silent cardiac distress often goes unnoticed until it's too late. Many people dismiss subtle signals of a heart distress, risking serious complications. In this video, we uncover the 5 hidden signs your heart might be crying silently and how to respond early to protect your health. Understanding silent myocardial ischemia requires grasping how reduced blood flow can manifest without our pain. When coronary arteries constrict moderately, cells endure hypoxia, triggering symptoms like fatigue or indigestion instead of classic chest pain. Historically, this phenomenon was identified in the 1970s when peer-reviewed ambulatory EKG monitoring revealed a sympathetic ischemia in a risk patient. Persistent fatigue is often dismissed as overwork, but can signal myocardial oxygen deficiency, reducing energy availability at a cellular level. This insidious tiredness persists despite adequate rest that disrupts daily activities, decreasing productivity and mood. During silent ischemia, intermediate coronary constriction limits ATP production in the cardiomyocytes, leading to sustained tiredness, while cardiac biomarkers often remain normal. Ambulatory studies found fatigue correlated with ST segment depression. Incorporate daily low-intensity aerobic exercise sessions, about 30 minutes. 5 times weekly. Boost coronary circulation, or replace one sedentary break per day with a brisk 10-minute walk. Consult a cardiologist if fatigue persists beyond 2 weeks. Frequent indigestion or heartburn may be mistaken for gastric issues, but can indicate silent ischemia episodes. When acid-like discomfort masks cardiac pain, this indigestion is often accompanied by belching or bloating that fails to improve with the antacids. Subunded cardiac ischemia triggers vagal nerve stimulation, causing epigastric discomfort and acid sensations. One study reported 68% of patients with a silent ischemia experienced non-anginal pain or dyspepsia. Track digestive symptoms in a daily journal. Noting time relative to meal or stress. Aim for at least 2 symptoms log entries per day for 2 weeks. If patterns align with stress or excretion, follow up with a stress ECG test, recommended within 30 days. Unexpected breathlessness during mild activity can reflect reduced cardiac output rather than pulmonary issues, limiting oxygen delivery to tissue. Diastolic dysfunction causes elevated left ventricular and systolic pressure, promoting pulmonary congestion. Doppler echocardiography studies link silent ischemia to increase E/E ratios in a sympathetic patient. Monitor respiratory rate during a routine test. Aim to measure the record breath counts for 1 minute thrice daily. If shortness persists for over a week or exceeds baseline by more than 20%, seek a cardiopulmonary exercise test within 14 days. Exercise sweating without heat or excretion often gets misunderstood to anxiety or menopause, but can signal an immune response to myocardial stress. Silent ischemia provokes sympathetic activation, increasing pseudomotor responses. Telemetry reports show cold sweats as a prodrome in 32% of silent heat events, but sweats daily, nothing complex, and frequent 3 times daily. Wear moisture-wicking clothing to differentiate stress-related perceptions. If episodes exceed 3 per week, consult with a cardiologist within 1 month. Subtle discomfort radiation to the jaw, neck, or the left arm may be mistaken for a musculoskeletal strain, but often originate from nerve pathways shared with the heart. Convergent transmission in the spinal dorsal horn causes referred pain in the somatic region. Clinical data revealed referred jaw pain in 22% of silent myocardial infarction cases. When mild pains rise with the clear physical restraints, pause activity and apply a cold pack. Schedule resting. ECG within 72 hours if pain requires more than twice in a week. The development of a silent cardiac distress arises from multiple underlying mechanisms and risk factors that compromise coronary circulation and cardiac resilience. Coronary atherosclerosis. Progressive plaque buildup narrow coronary arteries, reducing perfusion under stress and predisposing to ischemia without overt angina. Microvascular dysfunction. Impaired dilation of small coronary vessels limit abductive blood flow increases, provoking ischemia episodes, even when major arteries are unobstructed. Excessive sympathetic tone. Related to the parasympathetic regulation, raises heart rate and vascular resistance, increasing oxygen demand and triggering silent distress. Regular high exercise. How to schedule 30 times of brisk walking or cycling 5 times a week to enhance coronary vessel growth and improve myocardial perfusion. Stress management. How to practice daily 10 minutes guided breathing or meditation session to reduce sympathetic overdrive and stabilize heart rate. Sleep optimization. Stress management. How to maintain consistent sleep-wake cycle. Aim for 8 to 7 hours per night and avoiding stress 1 hour before bedtime promotes cardiovascular recovery. This strategy supports heart health by improving endothelial function, bleaching out autoimmune icons, and reducing skin. We explore 5 silent sessions. Your heart may be struggling. Early recognition and timely action can prevent serious events. If you experience any of these symptoms, consider tracking them and consulting a cardiologist. Like, subscribe for more heart health insights. Remember, professional guidelines is essential for personalized care.